Good evening and welcome to tonight's edition of This Flag Thursday. Tonight we're going to discuss the current state of our public health system following the overwhelming response we've received from various citizens following our expose last week when the doctor strike started. The health sector is inundated by multiple problems, including poor budgetary allocation, poor working conditions for doctors, a very low on-call allowance, not enough hospitals in the rural areas, obviously exacerbated and made worse by the cash crisis, the water crisis, and the power crisis currently bedeviling our economy here in Zimbabwe. Efforts to get both Dr. Parenyatwa, who is the Minister of Health, and Dr. Gwinji, who is the Permanent Secretary in the Ministry of Health, yielded no fruit, as they did not respond to our request to engage. One of the core features of this flag is to build a culture of engagement with our public officials and to hold them to account when the public administration is not functioning as it should. The key question to ask, particularly as regards public health, is why are our public officials, why is the Minister, why is the Permanent Secretary so unwilling to engage on these issues? Today is day 9 of the doctors' strike, and in a statement released yesterday by the doctors, they indicated that there's been a very sluggish response by the minister to their demands. None of those demands have been met in full, and there's been no response whatsoever to the call to increase their on-call allowances from $1.20 to at least something reasonable. Currently, they're asking for this allowance to be raised to at least $10 per hour. Obviously, the doctors are also calling for a tax incentive as they import their motor vehicles, and also a more appropriate and functioning system as regards the employment or recruitment of interns following their internship. Today, our program is going to attempt to delve into the issues that our government refuses to address. If the government won't level with us, the citizens will have to investigate.
In my case, my grandmother was miserably failed by the health system. She was first admitted to Chinhoyi General Hospital when she suffered a stroke. The hospital barely had any necessities to care for her. My mother, who originally stays in Bulawayo, had to literally go and squat at relatives' houses so she could ensure my granny was fed. They wouldn't even turn her, as per requirement, on people unable to move by themselves. We had to put together our meager resources to move to Bulawayo, where we could at least provide better care for her, or so we thought. Upon her admission at Mpilo Hospital, it took an excruciating number of days before she could be attended by a doctor. I'm ashamed to say we had to pull strings for her to see a doctor. Now, of course, nothing could be done for her. We ended up having to take her home and nurse her from home after she developed a fist-sized bed sore on her behind. We had to buy all her medication from SA because it was unaffordable to get it from here. Additionally, we had to hire physiotherapists privately for a rate of $20 a session. Needless to say that we struggled and could not give the sessions she required. What saddens me the most is that when my granny's situation deteriorated, after battling to get a doctor's attention at Mpilo Hospital, we literally had to pay for everything, including needles, for drips, pints of blood, and even the doctor's time. As a result of some of the delays that occurred when we were trying to raise finances, my granny passed after being terribly let down by our health system. Our pensioners shouldn't have to be exposed to this level of derogatory treatment in their own motherland. I'm still hurt even up to now.
The response of the government to date is that there's simply no money to finance the public health sector. What we have to bear in mind as citizens is that this is the same government that never runs out of tear gas when it needs to crush a demonstration. It's never short of water cannons or police cars. How can a government that runs out of painkillers never run out of tear gas? Now, it's important for us to probe the figures a little bit. We all know that this week was the president's birthday. Last year, official reports suggested that $800,000 was spent to celebrate the president's birthday by the 21st February movement. Although we don't have official reports as to exactly how much was spent on his birthday celebration this year, some analysts suggest that it's a similar figure. Now, the 2017 budget has allocated only $282 million for the year to health. This is approximately 6.88% of the total budgetary allocation. This is a drop from 8.2% that was allocated to public health last year. Now, Dr. Parinyato has indicated that in order to get the public health system functioning again, the government would require about $1.3 billion. Now, what does that mean for a citizen? It means that in view of the fact that our government lost $15 billion to diamond looting and corruption, this money could have fixed our public health system at least 10 times over with change. Now, the Abuja Declaration was signed by a number of AU countries in 2001, and the recommended budgetary allocation in percentage terms for public health is 15%. Our government spends less than half of that on public health. Now, let's look at what our government does spend its money on. 340 million is allocated to defense. Why? Zimbabwe is not at war. Why spend more on our soldiers than on our doctors? Why spend more on guns than on cannulas? Home Affairs gets $364 million. Why are we more concerned with buying police cars than we are with buying ambulances? Why are we happier to pay our police officers than we are to pay our doctors? Now, the Office of the President and Cabinet has been allocated a whopping $175 million. Now, why is this important? Obviously, we're aware of the background that healthcare facilities in Zimbabwe are running at 30% capacity. But obviously, the president has no interest in spending a lot of money or improving the budgetary allocation for public health because he himself does not use our public health system. It's well documented that he goes to Singapore when he needs to access health services. His own daughter will not give birth in a public or a private hospital in Zimbabwe, but will travel all the way to Singapore in order to merely give birth. Now, this obviously must be considered in the context of our own maternal health mortality rates in Zimbabwe. It's documented that the maternal health mortality rate is unacceptably high. Reports say that every day, an average of 6 mothers die due to pregnancy-related causes, and yet pregnancy itself is not even a disease.
In 2015, I gave birth to my baby. He was preterm at 24 weeks. I gave birth at a general hospital here in Zimbabwe. I tell you, things are so bad with our health sector. Our public hospitals do not have incubators or any intensive care system for preterm babies. So because there were no incubators, I had to be transferred to a bigger general hospital. To get there, I was transferred using the hospital's ambulance, which also didn't have an incubator. So my baby had to endure an hour, depending on the body heat of the nurse who was holding him for warmth. The ambulance was in such a bad state. No shocks. I could literally feel every bump on the road. It was excruciating. So we finally got to the hospital. The time came when I had to feed the baby. But this was delayed because the hospital didn't have feeding tubes. And after some hours, the feeding tubes came. But the nurses were so cruel to me, forcing me to breastfeed when clearly it was impossible because I hadn't started producing the milk. In all that period that I was failing to breastfeed, I don't know if my baby was fed anything. My baby later on gave in and he died. My point in sharing my story is that I want to appeal to each and every Zimbabwean listening to me. There's so many people dying before their time because our health system has crumbled. Our president flies out for medical treatment. It haunts me every day. I think to myself, if only our government cared enough for us, they would make our public hospitals, they'll make sure our public hospitals are well equipped. It haunts me every day, and I think maybe if our hospitals worked, maybe if the health system worked, maybe, just maybe, my baby would have survived. I don't know about you guys, but I'm really tired of standing by and doing nothing about our situation. The government will never stop violating our rights as long as we do nothing. So please, let's not waste any more time. Let's come together. Let's unite and fight against this tyrant.
Still on the president and the first family, a Zimbabwe Independent newspaper report this month indicated that last year the president spent $36 million on foreign and domestic travel in the first 10 months of 2016. This obviously piles huge pressure on a cash-strapped government failing to buy basic painkillers and drugs for public hospitals. In a number of our feedback from doctors, they indicated that a lot of the time they spend their own minimal earnings on buying cannulas for patients, on buying painkillers for patients, on sponsoring a patient who can't afford blood or gloves. This is completely unacceptable in 2017. A further important statistic is that 80% of the medication we see in our public hospitals, whether it's at Chitungwiza General Hospital, United Bulawayo Hospitals, Parenyatwa Harare Hospitals, is actually donor funded, meaning that our government has decided to leave to the women caprice of donation something as vital as fundamental basic drugs. Now, this must be viewed in the context of Section 76 of the Constitution, which guarantees the right to access basic health care. This is a right which our government continues to violate by its refusal to put money in something as important as public health care and to prioritize in its place the security forces, the police, presidential travel. This is unacceptable, and this ought to cause outrage on the part of citizens because we're having unnecessary deaths in our hospitals for the simple reason that our government does not care.
I'm a doctor, and as part of my training, I had to do a one-year clerkship at a local hospital. I did part of my training at Zimbabwe General Hospital. And the conditions I witnessed, they were appalling. I got there on my first day, and doctors were running around trying to raise funds to buy chairs. The hospital didn't have enough chairs for patients to sit in and recover. Now imagine having to spend the whole day bedridden because the hospital doesn't have enough chairs. As if this wasn't enough, I got to the labor ward and it only had 2 beds. This is a general hospital that only has 2 beds in its labor ward. Now to us Zimbabweans, this may sound normal because we have no choice but to accept the medical care that's available to us. But this is a normal. For patients that don't have medical aid or can afford to pay for long hospital admissions using cash or funds sourced from relatives. Their fate is death. Now, let's forget about all the people that we know who've disappeared or been killed. Is this not an indirect way of killing people? Imagine the number of children starting their life. They had to sacrifice them just because a 93-year-old continues to cling to power. Do we not deserve better? Do we not deserve a healthcare system that works? Something needs to be done. We need our healthcare system fixed.
A discussion on the broken public health system in Zimbabwe would not be complete without an analysis on the impact of corruption on our public health system. According to a Newsday report recently published, Masvingo General Hospital had an incident where a dialysis machine went missing. Its parts were stripped to pieces before it was even installed. There have been several reports in addition to that where hospital equipment has gone missing, and there's been impropriety around the tender process for the purchasing of hospital equipment. We also have a difficulty with the looting of on-call allowances. A 2015 report highlights an admission by Dr. Parenyatwa, who's the Minister of Health, on the fact that top ministry officials were looting on-call allowances even though they never work on call themselves, which were meant to be directed to hospital doctors. Now, in addition to that, we obviously have the story that we carried some weeks ago on the fact that drugs are unavailable in government pharmacies, but will be available in a private pharmacy which is housed within the public hospital complex. This is obviously problematic for any citizen looking at the situation. Now, the corruption around public health in general is compounded by our broken medical aid or medical insurance system. We're all very aware of the scandals that have rocked PISMIS, the scandals that have rocked CMIS, and the difficulties around medical aid being claimed at Corporate 24 Hospital. Part of the difficulty is the unregulated nature of medical aid societies, which has left citizens exposed to being exploited by these institutions. The idea around medical aid is that a premium is paid by the citizen every single month, which can be recouped in the event that they have some sort of public health issue or public health emergency. However, because the system has fallen apart, we've got a situation where most private and even public hospitals demand cash up front, which most citizens in this economy cannot afford. There is a need for the authorities to regulate and bring to account those who are responsible for medical aid societies in order that citizens do not suffer.
My grandmother died at 88. Up until her death, she had been a member of a medical aid society. She was never really sick, minus a cold or two, so for most of her adult life, she had been contributing to her medical aid scheme. When she suddenly fell ill and had to be hospitalized, despite her medical aid, we had to pay cash up front for her to be admitted into the hospital. She was in hospital for 2 weeks. Her total medical bill came up to $14,400. Our family had to pay $6,500 in shortfalls, which included specialist fees, doctor's fees, as well as part of the hospital fees. After her lifetime of medical aid subscription, her medical aid only paid out $6,000. Not to mention the additional $1,500 we had to pay in cash for pharmacy prescriptions. We were fortunate enough to know someone within the Medical Aid Society who advised us that we should submit pro forma invoices before making any payments, instead of making a claim after we had already paid. Making a claim after you had already paid for a service indicated to the Medical Aid Society that you had money, and therefore this would make it highly unlikely that you get your money back from the medical aid provider. We were also lucky enough to be able to raise some of the cash needed from family in the diaspora and those who could locally. This made it possible for her to have a fair chance at recovery. But what about those who are not so lucky? We are still paying some of those debts today. What is the point of medical aid if you have to pay cash first? Think about it. Her entire contribution reduced to $6,000.
Now, the stories that have been told today only scratch the surface. There is so much more information and evidence that must be dissected. However, what's clear from this evening's expose is that our public officials are nowhere to be seen and have no intention, or have so far demonstrated no intention whatsoever, to try and resolve the impasse and to take a look at how to fix the crisis. As citizens, we must continue to demand that the public authorities, the Ministry of Health, the Permanent Secretary in the Ministry of Health, fix our health system. Now, this flag, as one of its core features, requires citizens to ask, to speak, and to act. So we're going to close off tonight's conversation with a call to action, which is broken up into 3 parts. Firstly, the citizens must demand that Dr. Parenyatwa, our Minister of Health, engages with the citizens on the corrupt and broken state of our public health system. Secondly, each and every citizen, each and every public servant, each and every individual must stand in solidarity with the doctors, because without doctors that are operating in sound working conditions, the public health system can never function properly. Without these doctors being motivated and working in conditions that are satisfactory and to an acceptable standard, we can never fix or begin to fix the rot that we see in public health today. Finally, each and every citizen must continue to speak out and expose the rot and brokenness of our public health system. We must continue to have the conversation around public health and offer some sort of solutions that could go some way towards resolving our broken public health system. And so that will be all for this evening. Until next week on This Flag Thursday, my name is Fadzai.
Tobatanidza moyo yedu